started. Thank you.
Hi, everybody. My name is Ashley Elliott, and I am a rheumatology registrar based in Belfast. And I'm also the Northern Ireland trainee rep for Northern Ireland. And you're very welcome tonight to this webinar looking at a career in rheumatology. So I hope it will be of some benefit and relevance. And we've got a panel of trainees, fellow trainees, who I'm going to introduce in just a second. But the focus of tonight will be looking at what real life looks like in rheumatology for both paediatric and adult rheumatology. We'll also be hopefully giving you some tips for how to secure a place in rheumatology, getting a training number. And yeah, just also we'll touch on the interview process and the application process. And again, as Grace has said, just any questions and we'll try and aim to answer those at the end. There's also a poll function we have at on your screen on the right side. If you're able to fill in that poll, that just gives us an idea of at what stage of your training you're at, whether you are a medical student or foundation trainee, core medical trainee, or at another stage of your training. It just helps us to get an idea of where. That's really helpful. Thanks for filling out already. Yeah. Further ado, we'll get our panel on. So tonight we're joined by Dr. Caroline Cotton. Caroline is an ST6 in Royal Liverpool, and she has experience to date so far in both clinical and academic training. And we've also got Dr. Sajida Rasul, who's also a senior paediatric rheumatology trainee. She's ST8 and she's in the Royal Manchester. And so if the panel's there, we'll...
Everyone.
Hi, guys. So what I'm going to do is I'm just going to run through a couple of questions, and I'm going to ask you both the same question. And again, we'll start off with you, Caroline. So, Caroline, just can you give us an idea of when it was in your training that you thought about a career in rheumatology, or what piqued your interest? And is there any tips that you would give for guys thinking about a career in rheumatology, how to improve their CV or improve their chance of success at interview?
So I had sort of done my core medical. I had really done a job in rheumatology, but I knew that I was quite interested in specialities of the system, and I knew that sort of interested me. I knew that I definitely didn't want to do something that was very procedures based. I wanted to be more medical based, and I quite like with rheumatology that we follow patients up and we see them over a long time. Yeah. So that was sort of, so I finished my core medical training and was a little bit, I'm not quite sure what I wanted to do. And I went and spoke to one of the professors of rheumatology that was in the hospital I was working at the time. And he said, we've got somebody on maternity leave and you can do 3 months to cover in a last job and see if you actually like it. And it gave me a bit of an idea about what rheumatology was like. So I covered that for 3 months. And then got a little bit of experience trying to get involved in audits and things. So it gave me a little bit so that when I was going to interviews, I could at least answer the questions on rheumatology, pull back on a bit of experience, and sort of had a little bit of knowledge and knew that I actually liked it. So it showed that I had a little bit of experience and knew what I wanted to do. So I sort of came at it from that angle, really.
Yeah, yeah. I think it's so, you know, it can be some of the simplest things, like getting, as you did, like getting in touch with someone who's involved in the specialty or your training program director, and just showing your interest. And even small projects like getting yourself involved in an audit or something that could lead to a poster, you can tick off a lot of boxes straight away and really show your interest in the specialty quite quickly. Yeah. So just similar question then, Sajida, for you, what obviously in pediatric training it's slightly different in that you subspecialize later on, but what was it during your, I don't know, pediatric training that made you think about a career in rheumatology?
It was
And is there any
actually
tips
my F1 placement at in adult rheumatology that made me want to do rheumatology. I think
Okay.
way before I became a doctor, I decided I wanted to do pediatrics. But when I did a placement for, I think it was only 3 months in F1 in a big centre, that I saw just the variety of pathology, which is kind of keeps the day interesting, and one day is never the same from day to day throughout the week. But also the way the team works, it was a really nice kind of example of a academic speciality with a really good team ethic. So that was the first kind of taste of of rheumatology on the whole. And obviously that team had close links with the paediatric teams for adolescent care and transition, which meant that I had a little bit of input from the pediatric teams, and that was a bridge into pediatric rheumatology. And then as a pediatrics trainee, I took the opportunity to be placed in rheumatology placements. So I asked our training program director to put me into pediatrics as an SHO, and then I also got it as a registrar to get an idea of what it's like at both stages, because as everybody knows, a speciality and certainly what you do from the day to day as a doctor changes from as you progress. And thankfully, I liked it from SHO through to registrar level. Plus the opportunity to really look at non-clinical aspects of medicine, which I think you miss out a lot on. Certainly from early years in F1, you don't really know it unless you know it. And I think rheumatology, just by the nature of it, means that you do get an opportunity to kind of branch out a little bit. And it is fascinating. I might be biased, but...
Yeah. Oh, yeah. We'll all agree here. Cool. Yeah. No. Very true. I did it as a CT1 in rheumatology, and that was a good opportunity. I had a bit more time because I did it first off to get a chance to get my CV ready for a job. But yeah, I completely agree with the interesting point. So just then the next question. So obviously with COVID, things are all different for everybody, and we all have to adapt at the moment. But thinking about even what things were like pre-COVID, and then as we return hopefully to normality next year, with some of the changes that may be lasting long term from what we're learning now. But what would a normal working week, Sajida, for you, what would a normal working week look like for you in pediatric rheumatology?
So a normal working week, I mean, yeah, you're right. Coronavirus has changed the face of, everything. Apart from the fact that we've been deployed and things much like adults, we've also now seen the aftermath of coronavirus infection in children. So we have a lot of pediatric multi-systems inflammatory syndrome, and those children are very sick and requiring quite a lot of treatment, either on ICU or on the wards. But it does still give you a sort of a flavour in the way that we manage patients and the kind of medicines we have access to and what we're thinking about and the kind of train of thought that we have. So typically, paediatric rheumatology is largely outpatient based. So there's a lot of emphasis on managing our largest chunk of patients, which are juvenile idiopathic arthritis, as outpatients. There's a big emphasis on multidisciplinary team working. So often you'll find pediatric rheumatology teams are very much an extension. So the doctors are an extension of a massive team of OTs, physios, pharmacists, psychologists, and then obviously the research nurses as well. So a typical week would be largely made up of outpatient clinics. We have a joint injection list. No matter where you go, that happens. And in pediatrics, we do them under general anaesthetic and with Entonox. So those are set lists, which means there's a bit more of an undertaking to do them. but an opportunity to do complicated joints like metacarpal joints in tiny children, 2-year-olds, which can be quite tricky. And we have another kind of part of that is a large part of rheumatology I found in pediatrics is the X-ray meeting. So a lot of discussion with colleagues in other specialities. A lot of the some of the clinics are kind of branched out again to other subspecialities. So we have regular renal rheumatology joint clinics and renal immunology joint clinics. And being a large tertiary centre, we have multi-centre clinics sometimes as well to incorporate things like Behçet's, for example. But those are kind of less frequent. And then obviously there's the acute element. So within that's interweaved into the outpatient timetable of the week, we have our inpatients who are largely patients that are flaring, newly diagnosed JIAs or juvenile dermatomyositis, for example. And they can tend to need a lot of care and attention and are often undergoing a lot of investigations, which can be tricky, but can be quite time consuming. That's a typical week. A coronavirus week, slightly different, but a similar theme.
Yeah. And Caroline, same question to you then in the adult rheumatology world. What would a normal working week look like for you?
So it's probably 4 clinics, one of those often an injection list. We do in adult medicine also cover the general medicine rota, and depending on where you're working and particularly what area you are, that will differ how much you'll do. So you will cover some rota and some of your time will be general medicine. We do also, like paediatrics, have the same sort of MDT clinics. So particularly in some of the teaching hospitals, you'll have a Behçet's clinic, for example, where it'll be combined with dermatology, neurology, ophthalmology, and we do the radiology MDT as well. So it's always mixing with other clinicians, which is quite nice.
Yeah, I think as well in our specialty, sometimes, I mean, I don't think people necessarily know exactly what we do in rheumatology until maybe they get experience of doing it. And I think the presumption is that our week consists of looking at, which is a part of it is a lot of arthritis and chronic arthritis, but we also deal with lots of other conditions, and sometimes you're dealing in case report territory with some of the conditions we're dealing with. And having to line up with other specialties, it can be incredibly interesting, and you can sort of realize that you're dealing with things that really top specialties are having to debate and talk about and consider. And I know as well, when you're talking about in adult training, you're covering GIM and you're doing your rheumatology, but also when you're seeing rheumatology referrals in the ward, sometimes you're called as a kind of I don't know what this is going on, let's ask rheumatology, and I always wanted to be, I mean, I liked watching, I like, I love the ER, but I also love like house. I love being the doctor at the end of the bed thinking, let's all think what this could be, it's maybe not the coolest, but well, I think it's the coolest, but that is a big part of our job, isn't it?
Yeah. Definitely the 4 volumes of notes that need to be gone to try and work out all the investigations someone's had. With that, but it may not be everybody's cup of tea.
It's also the nice expensive tests.
It is a real mix.
Yeah.
Sorry?
It's also the nice expensive tests that we end up ordering.
Yeah. I know people. Sometimes they do regret calling us when they have the test we have to ask. But and I do think there is a real variety in our weeks as well, which sometimes there is a big focus on outpatient, but as you say, there is the inpatient care. We actually have an inpatient ward in adult as well in Belfast, and but also we do have joint injection. We do a lot of ultrasound and Yeah, so it can be good for a variety. Okay, great. So I suppose leading on from that, then, Caroline, back to you, just with in terms of thinking about rheumatology to date and your training to date, what would you say have been some of the highlights and best parts of your job, but also some of the challenges, and I don't know what kind of personality you think suits a career in rheum?
So I think what I've really enjoyed is there's lots of options to get involved in research, or if you particularly want to try and improve quality of service, there's lots and lots of options for doing that. I like all the different conditions. As you say, I do like seeing some of the unusual things where you have to look up case reports and things. There's also quite a lot of specialist clinics, so you can get involved in that side of things. So you can be a scleroderma specialist, or and that there is that nice. Or if you want to be a generalist, there is also that. If you particularly like imaging, then there is ultrasound. So really good at those skills. So there is an option for people who have interest in different areas. I don't think it is just one type of person. I think some rheumatologists that will do general medicine and do a little bit of rheumatology, and they enjoy that of things. So I do think there are options for different personality types, definitely.
That's very true. Yeah, no, there is lots of different people that end up doing it, and yeah, you're completely right. And Sajida, just for you, what do you think has been some of the, I suppose, highlights of and best parts of your job as a pediatric rheumatologist, but some of the challenges?
So I love puzzle solving and that sort of kind of Sherlock Holmesy theme. And a lot of the patients that we get referred are, it's got a weird rash, or it's got a fever, we don't really know what's going on, or we've just diagnosed a patient with juvenile dermatomyositis with a myositis specific antibody who presented with bilateral eye swelling. It started off in ophthalmology, and her journey is kind of typical of the patients that we get. They a head scratcher, and it's super satisfying being like, we've got the answer. It's this. So there's that, and I think with the way rheumatology has changed with biologics coming in, biosimilars being available, it's just revolutionized rheumatology as we know. And I think it's so satisfying being able to treat patients to a point where, for us, that they'll go to university and have no issues in their general daily life. So those are definitely highlights. And the thing about pediatrics, you've got pathology from the age of 0 to 16, and that varies massively. So again, we have a newly diagnosed BLAU, which is early sarcoidosis. Genetic testing has confirmed that. And I think you just don't know, and that was all in the last 2 weeks. You just don't know where you're going to be pulled or what sorts of things are going to come out of the woodworks, which is, and again, it goes to my kind of point of it being fascinating. So those are definitely highlights. And I mean, I might be biased, but working with kids, it's, as cheesy as that sounds, is brilliant.
Yeah, cool. And do you guys, would there be anything you'd think in terms of challenges, or I suppose when you're thinking about the personalities that would be suited to a career in rheum? Is there anything else you would say about some of the challenges thought to date in real life training?
With the nature of rheumatology, you've got to be in it. Like it's a kind of an all or nothing, as most subspecialties are. I don't think you can go into it half thinking this will be all right, I'll coast through it. You need to have your finger on the pulse, because things are changing so quickly. And that means that you have to be doing things outside, separate, extra, to kind of make sure you're up to date, you know what's going on, to then be able to provide the best care, which is really why we're all here. So the challenge is then you've got your 9 to 5, you've got your out of hours, you're always going to be doing above and beyond. because there's an element of being competitive. It's a small speciality. You're going to have to do those extra bits, but also to be the best sort of rheumatologist you can be in either adults and pediatrics. I think it's the extracurricular stuff. And for pediatrics, we do out of hours as well. So we cover general pediatrics and our tertiary. But once you become a consultant, it's just it's just rheumatology. Okay. And I think that can be challenging, kind of switching your brain from general to then very focused rheumatology.
Yeah. And is there anything else, Karen, you would say about, I suppose, the mixture of GIM and rheum, and how you find that in your training to date? Caroline?
Sorry, you just broken up for a second there. Go on, sorry.
So I was just saying, how have you found the mixture of sort of GIM and rheum in your training?
Yeah, I don't particularly mind doing GIM, and it definitely is something that you get used to, I think. So I think as you're quite nervous, I think by ST6 you do get a bit more used to it. So
because I think it actually makes you probably a better rheumatologist as well. Knowing, just keeping yourself up to date with all the other. I mean, it is a multi-system specialty, but it's also good because you see so much other. I mean, unfortunately, with our adult patients, we do have, the lovely thing about peds is sometimes when they get better, that's really it. That's them. They're better generally, whereas we have sometimes as well, there's a lot of other conditions we need to make sure we're on top of and not. Really good. So I've just got a last couple of points just from our resource slide that we were just going to put up. I'm just going to talk through. This will be in a handout for everybody, and you can download it from tonight, and you'll be sent it out in an email afterwards. But I just wanted to talk through a couple of points. So, if there is what you've heard tonight, you are wanting a bit more information about rheumatology in general, there's a couple of sites there that can signpost you in the right direction. Obviously, I'm going to promote the BSR website, which has a really good section on careers in rheum. There's an article there on the BMJ from 2016, which again gives a sort of a real life sort of rheumatology experience. And the RCP London website has a good sort of spotlight on the specialty itself. But on from that, then the JRC PTB website is a good place to start if you're thinking about eligibility for the specialty. And the training, this is particularly important because the training pathways are changing, especially for those that are thinking of applying in the next year or two. It's going to be, for adult rheumatology anyway, it's going to be a 4-year training scheme with then an extra year of sort of your core training IMT years. And those will be different for different regions at the moment, and then they'll all kind of streamline over the next couple of years. But that's a good place to find out about the pathway. And then if you do think that you are going to apply to rheumatology, the ST3 website, recruitment website, is a really good place to look at the process for applying and then for interviewing, what that will look like. It's a really good place to start. For pediatric subspecialty rheumatology training, there's also a link there, and that really is again a place where for resources and signposting you in the right direction if you want more information. I've also mentioned there a good book about that I have found useful over the years. It's a relatively simple, straightforward book, but it's really useful just to get your thoughts organized, for preparing for interview, if that's the stage you're at, and sort of trying to organize, looking at the person specification that's out there for the specialty, and then trying to tailor your CV around that to get as many points as possible in the interview itself. And that medical interviews book I find really helpful for doing that, and also preparing you for the ethical stations. So just leading on from that, I'm just going to look now just to see if we have any questions. So first we've got some, okay, so I suppose leading on from what we were talking about there, any good interview tips? So the interview itself, it's the same as when I did it a couple of years ago, and the format, and Caroline can keep me right, but the format is 3 stations in adult rheumatology. This is, you will have a station on ethical station, you will have a CV station or a sort of a suitability for special commitment to specialty station, and then you'll have a clinical scenario. So the book I mentioned, the medical interviews book, that gives you a nice rundown of how to prepare your CV answers, and really try and look at your CV and split it up into categories like management, teaching experience, academic, posters, oral presentation, prizes, and try and word it in the most efficient way possible. Also, it gives you a format for how to approach ethical answers as well. And yeah, and also then the clinical scenario station, the 3rd station, that's something where you've got to do obviously a bit of reading around the different common presentations that you can see in rheumatology. And again, a lot of that is more to do in the interview with how you approach a patient and your methodology, and that you're sensible. But again, it's, you know, that will involve you having to do a bit of reading yourself just on the different presentations that could come up. But in terms of pediatric interview tips, Sajida, it's slightly different then for pediatrics.
Yeah, so the paediatric subspecialty application process starts a lot later in training. So it's 2 years, and you apply in ST5 of pediatrics. So you have to have done pediatric core training up until ST5. And it's multi-center, and the centers are nationwide. So, for example, my first center was Sheffield, so I did a year there, and then I came back to Manchester. And it can be as far spread as Glasgow, London. There is a bit of choice. So when you apply, you can decide how you rank the areas where the jobs are. And it does vary from year to year where the jobs are, because if there's a trainee in post and they're swapping with another trainee from another centre, they may not have a job available for a couple of years. So it's something to bear in mind if you're not really up to moving massive distances for training. That's something to keep in mind. So yeah, sorry, the interviews are it's a single station. It lasts about 20 to 30 minutes. You have an introductory question on a paper that you have to appraise. You have 30 minutes beforehand to prepare your ideas on a paper. It's just a general paper. The one that I had was about getting sterile urine samples on babies for a septic screen. You talk about that, and then you have a couple of questions from the panel. The panel's made up of the CSAC chair, who's the specialist, the subspecialist council chair, and they oversee your training and make sure you're getting the opportunities that you ought to be in order to become a paediatric rheumatologist. The rest of the panel are part of the CSAC committee, and then you have a general paediatrician there who kind of will ask questions, but also oversees the whole interview system. And it's made up of about 6 to 7 questions based on similar themes to the adult interview, so ethics, clinical scenarios. There's no particular clinical scenario. You're asked about clinical situations and how you dealt with them. That's the interview process. The application process is via the RCPCH website, and the link shows you the pathway. It starts off for all subspecialties, and if you go into the rheumatology section, it will show you what jobs were available in the last round, how many people applied, how many people were appointed, and what sort of job description it is for each of those jobs that were offered.
Okay, cool. And that's just following on, just looking through the questions here. There was just following on from that, I think you've answered this, but there's a question here. Is the only way to specialize in pediatric rheumatology through doing full-time pediatrics pathway first, or can you do it via IMT and then do pediatric rheumatology?
So I know a couple of people who do adolescent rheumatology, and they are adult rheumatology trainees. But sorry, just something's just flicked up.
No, that's
they're adult rheumatologists who have then gone on to cover adolescent rheumatology. I don't think there is any way of only doing adults and then flicking into pediatrics without having done pediatric training. The reason for that is because you need to have had that core training in order to be able to manage children. So for example, growth charts, development, that sort of thing, you do need to have a basic grounding of that in order to be able to look after children. And if you're on call rota for rheumatology, you need to, there's that element that needs to be, you need a grounding of. So I don't think there's an opportunity to do pediatric rheumatology without doing core pediatric training.
There's someone who's mentioned I'm a pediatric trainee and my interview is next week.
I saw that. So I think there was a question about how to talk about MDT. The thing is, I think what they're looking for is that you're interested in rheumatology, and that you are sensible and safe, but also that you have an idea about what doing rheumatology means. And I hate this term being bandied about, is it's rheuma holiday. And I think as long as you show that you understand that that's not the case, and that actually you have a real deep-seated interest in rheumatology, that can come out quite clearly. I think the biggest piece of advice I would give for anybody doing the grid interviews, they are next week, is to practice. It's really important to sit down and have a practice interview with a full panel of people if you can, or just practice what you're saying for some of the questions that might come up, and maybe even speak to your local paediatric centre to see if you can get a practice session of interviews. And if you have time to, if you are doing interview courses, or you've got access to one in the next few days, I would go for the ones that aimed at consultant level interviews, as opposed to kind of the new registrar level, because the interviews are aimed at a consultant peer sort of level, as opposed to a more junior registrar, because that's what you will be.
Great. And so we've got another question here. Caroline, I might direct this your way. So for portfolio purposes, does it matter if not all the projects, e.g. research and quality improvement, you've done are in rheumatology to get into training?
I don't think so. I think I did have an audit by the time I was applying, but I think I really want to know that I think it's better that you've thought about it, or that you've actually finished a project. So maybe if you've actually completed an audit cycle, been background and things like that. So I think, yes, it's nice that you've shown some commitment to speciality, but if you haven't got an audit project, then fine. Hopefully you've got something else. You've maybe got some experience that you can talk about. Would you say the same?
Yeah. I think it really, it is. A lot of the time, especially in specialty interviews, yes, you've got to demonstrate your commitment to the specialty, but you've also just got to tick a lot of boxes.
Yeah.
So as long as you have those boxes ticked, that is going to get you those points. But equally, you want to have something in there that shows that you've also done something with a skew towards rheum. But yeah, of course, that will all count and count quite well. There's another point. I'm an IMT1. I have done a couple of months in rheum as a trust grade doctor and found that all I did was service provision for Gen Med patients. I have opted to do rheum again in IMT 2 year now. What can I do differently to avoid doing the same thing again? Yeah, well, I suppose it's different places. I mean, COVID, we're all sort of changing the way we're working at the moment. I think it's just as well, I would advise just letting your consultant team know that you are genuinely interested in a career in rheumatology, and that you want to get an opportunity to go to clinics, to maybe, you know, is there certain courses that you could go on, and just show that interest that hopefully they could take you under your wing and bring you to some certain things to give you a real experience that you could then write down something tangible that you've got from that experience. Would you say that's fair enough, guys?
Yeah.
Yeah, I've seen there are quite a few medical students in the audience, and not to say that there's a finite time before you can do this, but the sooner you can kind of look at things to do to pad out your CV, the better. And it's great that you're thinking of rheumatology now, but as you say, audits and things don't all necessarily have to be in rheumatology. But if you've got, it's not, as Vivian Westwood says, it's not what you wear, it's how you wear it. It's not what you do, it's how you do it. If you're doing tons of, as Caroline said, if you're doing tons of audits that aren't finished, or you're not starting, or you're not designing, then they're not going to be very useful for you.
No, exactly. And ticking off a couple of boxes at once, trying to get a feasible project that you can do that's going to be realistic and that you can get a poster out of or something. I mean, one of the best bits of advice that I got as a junior was, put it in for some big conferences, because a lot of the time you'll get it it's if you put in the work and you've got an outcome, you will get it accepted in conferences. So just think about that and do something that's feasible. There's sort of two questions that are similar. Can there be flexibility in registrar training?
That's all right. The Paediatric Rheumatology European Society are very good at accepting abstracts for their young investigators meeting. Not to say they'll let anything in, but if you've got something that you want to put into an international conference, the young investigators meeting is a very good place to kind of start. They're very encouraging and very, very supportive.
Cool. Okay, great. And then just looking at, there's just two questions here that are similar. So can there be flexibility in registrar training for trainees that are unable to do general medicine due to health reasons but still want to do rheumatology? Or are the curriculum now completely combined? And then another question, is there any pure rheumatology training without GIM during the ST years? So my understanding is now, I now know that rheumatology training is dual, and the current status is that there is no room for doing both. But I wonder in certain situations, maybe during the training, could be something accommodated. I'm not sure. It could be a case by case, but that is the consensus now, that it is dual training. And there is no pure rheumatology post in adult?
I think if you weren't sure, and you particularly, you are an IMT and looking to do rheumatology, maybe have a chat with the training program director and see what they would say. Is I think most hospitals are now, or most placements now are dual.
Great, okay. But don't worry, it's not as bad as it seems. You get used to, yeah.
We should maybe say as well, they've just mentioned that the British Society of Rheumatology do have posters as well. So I think they were just mentioning in the chat that students.
Yeah, absolutely.
Yeah, BSR. So.
Yeah, there's lots of opportunity with BSPAR and BSR. And actually, there's times when you're going to meet other rheumatologists, and those rheumatologists will be on your panel. So if you're interested in rheumatology, a really good place to network and find out a bit more about it is to go to the conferences.
Yeah, absolutely. Is it better to do rheumatology post during IMT rather than foundation years? I mean, really, it's about getting that experience and seeing what it's like, I think. If you can do it at any stage, that's great. I'd probably say the more senior you are on your training, the more you'll get to do, the more you'll get to be maybe to have more hands-on in clinic and things like that. But I think it's just important that you just get some form of experience. What do you guys think?
I think it is important to have an idea of what it's like working in the speciality, but that doesn't always happen. If you can get taster weeks, I know in paediatrics you can get taster weeks during that you can get arranged, because logistically you might not be able to get time in rheumatology. And also, I know general pediatricians who have done a lot of rheumatology clinics, so they allocate a day a week for rheumatology clinics, and that's worked really well for them. And that's obviously will get experience in rheumatology. And just another thing about paediatric training is that you can do a specialist interest, which we call SPIN in rheumatology. And that means that you don't have to do the grid process, but you just have to have a year's experience in a tertiary centre in rheumatology. So you become a general paediatrician with rheumatology interest. So there's lots of different ways in.
Cool. And I think we've answered, so what are the positives and negatives of being a rheumatologist? I think we've sort of gone through that. I hope we've inspired you. So what's the next question? Oh yeah, so Edward asked, difference between musculoskeletal medicine and rheumatology. How much overlap is there? There is a thing called sports exercise and musculoskeletal medicine, doctor consultant, etc. So speaking from Northern Ireland point of view, we do have an exercise and musculoskeletal medicine specialty, but it is separate to rheum. Now a lot of rheumatologists would deal with disease that's related to sports exercise as well in our clinics. We do a lot of ultrasound scanning. Really, they are this. I mean, musculoskeletal medicine is rheumatology. You know, so that's a big part of what we do. We do deal with soft tissue problems. We will see people, especially at joint injection clinic, ultrasound scanning clinics, who may just come up for one appointment, and then it's something that we can fix with a joint injection or sort of MDT input. So there is, to answer your question, a lot of what we do is musculoskeletal medicine, sports medicine. There is a separate specialty, and I don't know what it's like in England. Do you guys know?
I'm not 100% sure.
I think it's separate. I think I think it's linked to orthopedics, from what I know. There's nothing in pediatrics. Often a separate thing that we refer our if there's something sport related.
Yeah, I think, you know, I know a couple of consultants, for instance, who have done a master's in sports medicine, and then they would focus some of their work, you know, would be to do with sports medicine. So you have that opportunity, and that's the great thing about rheumatology. Once you become a consultant, there's lots of different avenues you can take into how you want to sort of focus your career. So okay, I've got a couple more questions. How much of your rheumatology training per week is on the gen meds, SPR Rota, or at a tertiary and at a DGH hospital? So again, that really does depend, doesn't it? I mean, DGH, you're going to be doing a little bit, potentially going to be doing a bit more gen med, but it depends it really depends, doesn't it?
Yeah, it's completely variable where you're working and what is negotiated, and yeah.
Yeah. And in Northern Ireland, we do 2 years of pure rheumatology at the tertiary centre, which is quite helpful. You've sort of got that protected time, and then you do 3 years in DGHs, but it really is different per hospital.
Yeah, we do 2 years of GIM light and then 3 years GIM heavy in a tertiary hospital. So we do no year GIM. So it just depends on the region you are. Yeah,
yeah. How important is it to be academic and do research in rheum?
I think there's plenty of opportunities, is what I'd say. I don't think it's essential. I think there are a lot of rheumatologists that do clinics, but maybe focus more on ultrasound or more on the service. I think that's the great thing about it. You can make the job what you want your job to be.
Yeah, and it really lends itself to. Sorry.
No, it's okay. I was just going to say it's similar in pediatrics. There are people who go off and do PhDs, and that's great. And there are people who end up doing lots of research as consultants but haven't done PhDs beforehand. So it's a mixed bag. I think it's good to have a little bit of an experience of research, because there's so much of it in peds rheum and adult rheumatology.
Yeah. And it lends itself really well as a specialty to academic work if you do want to do that. It really does.
Yeah.
So, okay, if you take some time out for research during ST years, can any of the time also be used for training? Well, I'm doing a PhD at the moment, and I'm hoping so. But it really, again, you need to apply before doing it. You need to prospectively apply, and then hopefully you will be awarded time. And again, it helps if during your research, you're doing a little bit of clinical work, that you can count that towards. But that's something that needs to be negotiated just before you go on your research. Okay.
It doesn't count in paediatrics, if anybody's wondering.
Yeah. I appreciate you both find GIM useful, but are you all looking to be pure rheumatologists long term? Caroline?
I think for myself, it will depend what job comes up. I think sticking with general medicine does maybe give you a few more options further down. I think a lot of jobs are going to have general medicine with them, and I think it does give you that scope. There's a lot more available, particularly if you want to work in a particular area. So I think it just depends on what happens when you're finishing, and yeah. But I think a lot of jobs have got GIM with them now.
And I think a lot of people, they start off as, say, acute medics with rheumatology, and then they evolve as they go on in their careers and maybe start doing more rheumatology. But some say, and that's, again, there is flexibility there. Okay. So we just want to come down to last couple of questions. I'm an FY2, unfortunately missed my room rotation in FY1 due to the pandemic. What's the best way to get into research projects in room? Yeah, I think it's just really having a conversation with a local rheumatologist or the training program director in rheumatology in your local area. People are very keen to get involved. There's always work that could be done in terms of quality improvement and in terms of small research projects or things that you can help out in. And really, it's just having a conversation with a local rheumatologist to facilitate that, or they can direct you to the right person. What do you think, guys?
Yeah, that's great.
Yeah, it's having a chat with different people. And I've just seen a comment that rheumatologists are some of the most approachable specialists, and that's true, both in peds and adults. It is just I don't know, emailing somebody, even if you've not necessarily met them, and introducing yourself and showing that you're interested in. Not many people would ignore a person interested in their interest. It's
yeah, 100%. Do you think there will be any pure rheumatology consultant jobs in the future, or will they all be GIM in room? I think it's moving towards a model that it is going to be GIM in room, but in saying that, these things change cyclically. Sometimes there's a focus on making tertiary centers and making, maybe focusing on having lots of specialists, and sometimes there's a focus on having lots of GIM consultants. It really does change all the time. And what I can say to you from experience in Northern Ireland is, lots of people have dual trained, and then they start off in one role, and then it'll evolve over time, and you can really mold your job as you go on to what suits you. So don't be panicking about that. A weird but relevant question. I've been advised against rheumatology by other specialists, saying that there isn't enough money in this specialty. Any comments? I do it for the love. I'm doing research at the moment, so I definitely do it. So I can't comment on the, but no, I mean, I don't know. That's that. Yeah, it's a great. I wouldn't listen to anyone who's advising against rheumatology. It's a great specialty.
There's also a lot of private work in rheumatology.
Yeah. I was thinking. I think that.
Yeah,
certainly. Lots of people wanting to know whether they've got Ehlers-Danlos.
Yeah. Any centres particularly good for rheumatology registrar training? Northern Ireland, great. Danlos were great. Yeah, I think to be honest, from my talking to people all throughout the UK, the training's brilliant generally. I think. What would that?
I think most areas have got specialist centres, specialist clinics. Yeah, quite
Yeah.
good together.
And if there is an area you're particularly interested in, that's a good point, actually. Yeah, if there is, there's a lot.
The only difference I've noticed is based on demographic. So if you're in a certain area where the demographic lends itself to tons of lupus, you'll have a different experience. And then again, the other way, you've got just loads of JIA, for example. Pathology definitely does vary.
Yeah. As finally a medical student, foundation doctor, are there any things that would help with getting into room training? So I suppose we've touched on that. In the sort of the questions. So I hope you've got a couple of bits of tips in there. But really, I think the main thing is really reaching out to your local sort of rheumatology service and just getting involved. Getting a taster week if you're not working in room, and really trying to start thinking about small projects that you can do to get involved, and thinking about attending conferences or getting posters submitted to those conferences. Just simple things like that. Okay, great. So there's a question from, okay. I think if there's a couple of other points, but I don't think I've got any more questions that I can see. There's Bernard confirming that rheumatologists are some of the most approachable specialists. Yeah, great. Thanks, Bernard. That's true. Okay. Well, so I suppose we've run over a little. So I suppose there's nothing further to do than just say thanks so much to our panel tonight for taking the time to give us their experiences. And also thank you for everyone who attended. The handouts, as we said, there'll be some information on resources that we've talked about. And again, if there is any further questions, get in contact, or even get in contact with the trainee group in BSR. We have a feedback survey that's just popped up there, and we really appreciate, because we want to do more. Obviously, we're going to be moving more and more to virtual things and doing more and more sort of rheumatology career webinars, and we really appreciate your feedback to guide that. So I think that is us. So if there's nothing else, I hope that was of some use. And yeah.
It's been nice chatting to you.
Thanks so much, guys.
Okay. Bye.